Hey, good afternoon, everybody. I'm Sue Musson, the Chair of Liverpool University Hospitals, and I'm delighted to welcome you to our annual members meeting. I really appreciate you taking the time to join us in what I hope will be a very informative session. Let me just set out the programme for the annual meeting, which relates to the financial year April 2021 to March 2022. In a moment, we'll start the meeting as we start our board meetings with a focus on a patient story, which is going to come today from Maria Guerin, and this will focus on the implementation of the SWAN end-of-life model across the Trust. We'll then have a video from the Council of Governors introduced by Lead Governor Andrew Moran to present a report on their work over the course of the year. After the video, I'll set out our year in review, including some of the highlights and challenges that we faced. And then I'll invite our Chief Executive, James Sumner, to give the final presentation of the annual members meeting. And James will be summarising recent developments at the Trust that are very essential to shaping the future direction of the organisation and the way that we deliver health care services across Liverpool. Finally, we'll hold a question and answer session. We've received a number of questions from members in advance, so thank you very much for submitting those. For all of the questions that we've received, we'll bring in a member of the team from the Trust Board who will provide a response. And for any questions that may occur to you as the meeting is progressing, let me just draw your attention to the live chat option on screen. So please do feel free to enter any additional questions using that option as the meeting is progressing. We'll aim to answer as many questions as possible, time allowing, and just a reminder that all of the questions that are asked, whether they've been submitted in advance or whether they come live during the event, will be captured. The questions and the answers will be captured on our website, and we'll include a link to that in the chat box as the meeting progresses. So an important part of our annual meeting is making the Trust's annual accounts and annual report available publicly. We've uploaded an explanatory video on our financial results to our website, and the video sets out the Trust's end-of-year financial position. Some of the key facts that are contained in the video set out the Trust ended the financial year with a balanced operational position. We received an unqualified clean audit opinion. Our finance teams received awards for the quality of financial management that they deliver. And over the course of the year, the Trust received £1.15 billion in income and spent an average of £3 million a day. And we finished the year with an end-of-year balance of £211 million. So there are links in the chat box to the annual accounts and annual report as full documents. So those are available should you wish to look into that in more detail. Okay, we'll move on to the next item on our programme, the patient story. So today, as I said, we're going to hear more about the SWAN model for end-of-life care. And I'm delighted to introduce Maria Guerin, Quality Matron, who will tell us all about how the end-of-life care team are working to provide the best possible experience to patients and families. And we'll also hear a patient story. Thank you.
Good evening, everyone. Can everybody hear me okay? We've been having a bit of trouble today, thank you. Thank you very much for this opportunity. It's really exciting for me to be able to come and share the SWAN model of care that we've implemented over the last couple of months across the organisation. And what I'm going to do, it's not much time to really go into depth, so I'm going to give a very quick overview just to give people an indication of the enormity of the impact of the SWAN model will have on our patients and our care. So the ethos of the SWAN model, it's to enable our workforce to work together regardless of their role and to be confident in providing true personalised care and for that to be compassionate. The Swan actively promotes collaboration across all organisations, and we're working right across the city footprint with our bereavement services, our community services, our emergency services, the coronial teams and the mortuary teams are all adopting this model. So the Swan model is implemented when patients are identified as being near to the end of life, or for those of our loved ones who've been affected by sudden or unexpected deaths, such as road traffic accidents or where people have taken their own lives. A Swan sign, which you can see here, is discreetly displayed in the area where the patient or the family are, so that everybody is able to identify. So it's a discreet communication tool. And the SWAN is also an acronym, as you can see here, regarding signs, words, actions and needs. And what that means to us is that the signs that somebody is nearing the end of life, that's being agreed by all of the teams that are involved, and actually that the patient and the family are aware of that. And then what words we use to communicate that. Are those words sensitively communicating, and are they in a language that patients and families understand? Because it's only when they can really understand those words that we can then move on to really implement SWAN, looking at what actions we need to do, what's really important for those patients, what actions can we do to help ease their comfort and help ease their pain, and what are their needs, what can we really do. So when implementing the SWAN, it gives control to patients in what's predominantly perceived as a very uncontrolled situation. People come into hospital, we put them in a hospital gown or hospital pajamas, and we take away everything that's personal to them. So it's reversing that and really bringing it back to what's important and what's personal to those patients and their loved ones. It really ensures that, I'd say, families and our patients have a voice telling us what's really important to them, what really matters to them now that they've understood the enormity of the situation they're in. It gives us an opportunity to assist in memory making, and that could be through handprints, through lip prints, through photographs of hand holdings, photographs of tattoos that people then can frame and keep them as a serious memento of their lives and their loved ones. It could be using the warmth of our knitted blankets that we get from our volunteers that very kindly donate knitted blankets and hearts that are made with love and care, often by people who've been through some traumatic situations themselves. And it could be having Christmas in July, having a wedding, having a beach party with the family. We've had people who maybe haven't been able to go on holiday and they've wanted to have that one last holiday. The list is endless. There are no rules to what we can do. We really just need to make it important for those individuals. So with that in mind, we actively encourage our staff to break rules that don't exist. And by that we say we can have a visiting dog, a visiting cat. We even plan to have a SWAN fridge where we can have the really nice foods that really can help people want to have taste for pleasure. By the nice foods, without being disrespectful to our hospital catering team, the nice foods that we could have, like the real nice Magnum ice creams, the nice luxurious trifles and jellies that we can get from Marks and Spencer's or Waitrose, and maybe even having some nice fluid drinks. And that could be the favourite coffee or the Coca-Cola or fruit juice, but equally it might be a Guinness, it might be a sherry, in my case it would be a Prosecco, but having those things equally available for people to be able to taste. We can visualize that when somebody hasn't eaten or drank for so long, that can be very distressful for their relatives, and the small amount of comfort they get from seeing their loved ones just licking their lips because they've tasted their favorite drink really gives them something to hold on to in such a time. The model also enables true personalised care. For example, what people will wear after death. So instead of it being carte blanche across the organisation that anybody who dies is put in a white shroud with a frilly collar that we would never ever wear if anyone died at home, we'd never wear it in life, so we really shouldn't be expecting people to wear it in death. So talking to families about what is the favourite top, do they want to wear a favourite Liverpool or an Everton or a football top, or maybe their own favourite comfortable pyjamas, so they know they're getting laid to rest in something that's personalised to them. And the SWAN bereavement nurses are also there to provide real-time support to anyone who may be struggling with grief after bereavement. They're also there for as long as it takes. They could be there to provide support to people who are having to wait and go through an inquest. So they're waiting, and being the bereavement nurses will be the link and the branch between the coronial officers and the families, which can be quite an onersome and really torturous and horrible time to go through. So SWAN, I hope I've demonstrated their covers from as soon as the end of life care is actually acknowledged and identified, the support is there for individualised care. I think what's probably the most difficult thing for people to realise is having these discussions. But I hope the story that I tell you from one of the wards here, the ward manager was going to come onto the call, but unfortunately she can't make it. So I'm going to read out her story, and I hope that will help demonstrate in real life what SWAN has done for somebody who was a patient on our wards. So the gentleman had been a patient on the ward for a month, and he had a terminal diagnosis. Sadly, his condition progressed while he was under the care, and he was identified as requiring end of life while he was in our care. As a ward nurse manager, we went along with the medical team to have a conversation with the patient, who wasn't very responsive, so we communicated with his next of kin as had previously been agreed. I had a clear but sensitive discussion around end of life care, and that we were adopting the SWAN approach, and that we had recently implemented this model within our organisation, and I explained what that meant. Obviously, this is never an easy conversation, and emotions were running extremely high from the next of kin due to the rapid decline of their loved one. But the family stressed how they felt that they really wanted the patient to remain on the ward, as it was in his best interest, and they could not fault the care he had had previously and had always been very comfortable. We started to explore what would really matter for the patient and how we could maybe give him some more comfort. We provided him with a nice knitted blanket that had been donated, and the family felt that this made him look far more comfortable, and he did seem to acknowledge that himself. He didn't have any pets that we could bring in, and he never preferred any alcoholic drink. So it was proven to be a little bit difficult initially for me to implement. But then when we talked about things more, we realised, and it came to light, that he had particularly missed the outdoors while he had been in hospital over the past month. He'd missed the trees and the misted grass. He'd always enjoyed the outside. As it was not appropriate to take the gentleman outside as he was so poorly, we had to wonder if there was a way we could bring the outdoors to him. So as a ward manager, I went away and thought what I could do. I then proceeded to get a knife and a paper towel from the kitchen. I walked downstairs and cut a small piece of turf from the grass by the car park, and I brought it back up to the ward. It was difficult to judge the effect on the patient, as he wasn't very conscious at the time, but we put the turf into a box and put his hand on the grass, and then we held his hand up to his nose, and you could definitely see that something had resonated with him. His family agreed. He definitely appeared to acknowledge this and even gave a little smile. The family were very touched by this and were really quite emotional, and they sat with their loved one, running his hand and fingers over the grass whilst they were talking to him in his last hours of life. After he died, the family complimented and thanked the team for such kindness. They said they couldn't believe that we made such a special moment so personalised for him at the end of life. Since then, the staff on the ward have spoken about how this affected them. It gave them some job satisfaction. They felt that they had resources to do things that they hadn't previously been able to do. And they felt very confident to explore this model further and have further discussions with other patients and relatives should this occur. We all feel that it was a true example of individualised, personalised care. So I hope that does demonstrate to you how something so small can mean something so lot to patients and families that they can take away with them. And as I say, it's very difficult in 5 or 10 minutes to really give you the true understanding and the true ethos of the SWAN model, but I'm happy to take any questions or talk about anything further. Thank you.
Thanks so much, Maria.
So
Oh, thanks so much, Maria. That was a really great explanation of the SWAN model and a really moving patient story. So thank you very much. And we will, have that option for any questions that people can produce in the chat box, and we can pick those up at the end of the session. But thank you very much indeed. Okay, we're going to move on now to our next agenda item. Our governors play a very vital and active role in supporting the work of the Trust. And this year, the Council of Governors have produced a video to deliver their report on all the activities that they've undertaken throughout the 2021-22 year. So the video is introduced by Lead Governor Andrew Moran.
Hello, I'm Andrew Moran and I'm the Lead Governor at Liverpool University Hospitals, as well as being a Public Governor for the Liverpool City Region North. Myself and other members of the Council of Governors are here today to tell you about the work we've done during 2021-22 to represent our membership and the people in our community. Firstly, to make sure that our public membership is representative of those living within our constituencies, we undertook a refresh of our membership database. We reached out to all of our existing members to confirm that they wanted to remain a member of the Trust and to make sure that we are communicating with them in the way they most preferred. Though this meant we lost some public members, we were really pleased to reach the end of the financial year with a strong foundation to build our Trust membership on. When it comes to staff, we continue to automatically enrol staff into our membership that fit the relevant criteria. By doing this, we make sure that we can voice their views from the earliest possible opportunity. So that our members can get the most from being involved with the Trust, it's important that we successfully engage with them. One way we do this is to deliver on our membership and engagement strategy. Some of the key things we did to improve our membership and engagement during 2021-22 were introducing a loved members bulletin to keep our members up to date on what's happening at the Trust. We also refreshed the Trust staff induction slides to promote awareness of the Council of Governors and our Trust membership amongst new staff. And we introduced virtual engagement events on topics of interest to those in our community, such as dementia awareness, menopause, sexual health, mental well-being and equality, diversity and inclusion. But this isn't all we achieved throughout 2021-22. So here are some of our fellow governors to tell you about the other great work we did.
Hi, I'm Joanne Pepper and as Governor I represent other non-clinical staff. In 2021-22, I attended an away day for the deteriorating patients, which also allowed me to look at deteriorating patients in the outpatient setting as part of my role. I supported the membership database cleanse with the corporate governance team, and I've also impacted the development of service structures.
My name is Dr. Sakeji Obi, and I worked as a midwife at the Liverpool Maternity Hospital for over 30 years. During my 30 years as NHS employee, I became passionate about health industry, quality of care, equality and equity in health. I really believe that all humans have the right to a good health service that is available to all. My constituency is the Liverpool South, and I'm a very active governor who have been involved in development of the new hospital and direction of the Trust strategies. I'm a member of Remuneration and Recruitment Committee, and I've been involved in the recruitment of non-executive directors. Also a member of Membership and Engagement Committee as well. I've attended all governors' meetings, observed the board meeting, involved in the designing the new membership form using the GDPR guidance and the diversity, equality and inclusion strategy, just to mention a few. I am proud to be part of the Trust, serving our population within the Mersey region and beyond. Thanks for listening.
Hello, I'm Dr. Bhavana Pandya. I'm a staff governor for medical and dental practitioners for the Trust. As a governor, I helped out in bridging the gap of communication between medical and dental staff and the Trust board. This was very useful for any queries to be resolved during the pandemic. I also attended engagement visits while walking around in A&E along with another governor and non-executive medical director. I also took up the queries from the staff from A&E and took them to the board to resolve them. I supported a Trust member in bringing their query to the annual members meeting. And this helped to resolve their query, and we also learned lessons. Thank you.
Hello, my name's Carl Roberts and I'm a League Governor for the North region of Liverpool. I've been a governor for 2.5 years at Liverpool University Hospitals, and in that role I've been able to help support and shape NHS services within the trust. I became a governor to represent the people of Liverpool, to represent my family, my friends, the public, my community that I live in, to actually give them a voice around health and care. During my term of office of being a governor, I've been able to influence and change in lots of things, but one main thing that I've been able to influence and change is some of the work that's done in our A&E departments. I've attended a number of meetings, and those meetings have been formal and informal, one of which has been coffee mornings where I've been able to meet with non-exec directors and other governors to talk about the work of the hospital. In addition, I've worked with the volunteer team at Liverpool University Hospitals and presented at their induction days to actually raise the profile of governors and how they can get involved in our work. I'm a member of the Membership and Engagement Committee, and that work, the work of that group is to actually recruit and retain members to Liverpool University Hospitals and actually recruit and retain governors, as well as engaging with local communities. Over the next coming weeks, I'll be taking on a new role, an exciting role as League Governor, and I'll be leading the Council of Governors over the next 12 months to help the organisation shape the future of health and care services. And I'm doing that with the help of the team.
Hi, I'm Chris Ashton. I am one of the 2 non-clinical staff governors here at Luft. I have been a governor since 2021 and I've been part of some amazing things over the last 12 months. I take part in regular coffee morning sessions, which allows governors and non-executive directors to be able to discuss issues that may not be relevant to council meetings, but we can raise and deal with them. I've been part of many national conferences and training sessions over the last 12 months, which has allowed us to expand our knowledge with other trusts as well. And I've been part of a new process which has allowed us to define the role of a staff governor. Me and a fellow governors were able to really get to the bottom of what it is, and then we can then go from there to really apply ourselves for the benefit of the trust.
21-22. We were joined by some great governors and non-executive many roles and responsibilities. In 2021-22, we welcomed Thomas Wally and Ibrahim Ismail and reappointed Neil Wilcox as non-executive directors on the Trust Board. Our Council of Governors also welcomed a number of new governors elected by our membership. These were Judith McGregor, Public Governor for the Liverpool City Region North. Ian Boycott Samuels, also a Public Governor for the North of Liverpool. Tristan Brown, a Public Governor for the Liverpool City Region South. Keith Pickup, again a Public Governor for the South of the City. Nolene Ryan, a Staff Governor representing our allied health professionals, scientists and technicians. Vanita Mishra, representing our medical practitioners and dentists. Andrew O'Sullivan, a Staff Governor for our nurses. Christopher Ashton, a Staff Governor for other non-clinical staff. We were also pleased to see elected for a further term Gerard Ashley, a Public Governor for the Liverpool City Region South, and Dory finish by saying that whilst 2021-22 brought with it some unforeseen challenges for all of us as a consequence of the pandemic, I speak on behalf of the entire Council in saying that it remained a pleasure to represent you all throughout the difficulties we faced, and we hope to see brighter times ahead. If you would like to find out more about the topics we have covered today, or you would like to join our membership to add your voice to influence how we shape and develop our services, you can find further details on our Trust website.
Okay, thank you. We're just going to stop the video and stop sharing for a moment while we reload the slides. But I did want to say that I know that we're joined virtually by many members of the Council of Governors, and I'm really pleased that you could attend today. As we heard in the video, Andrew Moran will be stepping down as lead governor at the end of his term ends, and Carl Roberts will be stepping into the role. Andrew's just been a fantastic lead governor for us, and I really wanted to thank him for his exceptional leadership and support in the role. I'm just so thrilled that Andrew's going to stay on as a public governor and will continue to support the work of the Trust. And just to say that we're really looking forward to Carl stepping into the role. He brings a wealth of skill and insight, and we're all looking forward to working with him. So on behalf of everybody at the Trust, I did just want to say a sincere thank you to all of our governors for the fantastic commitment and support that you've provided throughout the year. Thank you very much for that. Okay, we're going to move on to the next item on our programme, where I will have an opportunity to just provide a quick look back on the highlights and challenges that we've navigated during 2021-22. This has definitely been a year of transition for the Trust. We moved into a period of living with COVID and adapting to the massive impact that the pandemic has had on our patients, our staff, and our operations. It was also a year of transition and change in our leadership team, with some key arrivals, in particular, joining our executive team. Throughout 2021-22, the Trust worked hard to plan and prepare for the very significant changes to the delivery of health services across Liverpool that have recently been introduced in the current year. For example, despite the pandemic, work continued to complete the building work on the new Royal to enable it to open in this financial year. And similarly, a lot of activity and work happening on the Aintree and Broadgreen sites to support service moves that have taken place after the end of the 21-22 year. But although this was a year of transition, even with all the challenges, what had remained constant was the Trust's focus on our 4 strategic priorities, which we call our 4 greats: great care, great people, great research and innovation, and great ambitions. So on the next 2 slides, they describe the Trust and what it delivers to meet the healthcare needs of the people we serve who live in Liverpool, Knowsley, Sefton, throughout the Northwest region, and in some cases nationally. So this slide sets out some defining facts about Liverpool University Hospitals. We operate from 5 main sites: the Aintree University Hospital site, Royal Liverpool, the Broadgreen site, Liverpool Dental Hospital, and the Clinical Services Support building, which hosts Liverpool Clinical Laboratories. We provide secondary and tertiary services from our sites, serving a local and regional population of around 630,000 people. We are one of the city region's largest employers, and we have a significant turnover of more than £1 billion per annum. And as an organisation that's really based in the heart of the communities that we serve, we have a crucial role to play as an anchor organisation, which definitely takes us beyond just being a provider of healthcare services, working to support on a broader front. When it comes to our core business as a healthcare provider over the last year, we've had a very busy year. We had over 1 million patient interactions. These ranged from urgent and emergency attendances, outpatient appointments, and completing planned and unplanned procedures. During 21-22, we've seen an increase in the number of people attending our hospitals, 53,000 in emergency and urgent attendances, and over 100,000 more outpatient appointments. These numbers reflect the volume of people returning to our hospitals for care following the period of COVID-19 and the lockdown in the previous year. COVID-19 was and remains very much a feature of our work. During the year, we cared for 4,000 COVID positive inpatients across our hospital sites, and this very significantly impacted our operations, particularly constraining our ability to deliver some planned procedures as quickly as we would have liked. However, since December 21, theatres on the Royal and Broad Green sites returned to full capacity, although the theatre capacity on the Aintree site remained more limited. Throughout this time, the Trust continued to prioritise patients with cancer and those who were assessed as clinically urgent, resulting in the delivery of more than 12,500 operations for those individuals. And although we remain concerned about the numbers of patients waiting for treatment, by March 22, the end of this particular financial year, the Trust did make progress in significantly reducing the number of patients waiting over 104 weeks and 78 weeks for surgery, and this was in line with national guidance. Throughout the year, our emergency departments have been incredibly busy, presenting long waits for patients and significant challenges and really unrelenting pressure on our incredible staff. Despite these challenges, though, patient surveys continue to demonstrate that the overwhelming majority of patients are really happy with the care that they received in our hospital sites. Again, this is a great testament to the dedication, compassionate care provided by staff across the Trust. During the year, we also acknowledge the difficult and challenging outcomes of our national staff survey results and the findings of the Care Quality Commission inspection reports, which impacted on our overall Trust rating, changing those to requires improvement. As an organisation, we are fully committed to listening to colleagues and stakeholders to understand their experiences. This is fundamental in enabling us to make the necessary improvements so that we can fulfil our potential to be both a great place to work and a great place to receive care. Being a great place to learn and work is fundamental to us achieving our great people ambitions. There are some specific examples I wanted to highlight that illustrate how each day colleagues across all parts of Liverpool University Hospitals are living our values of being caring, fair, and innovative, and demonstrating those values in their work. Fortunately, we haven't got time to list every achievement and success, so here's a small selection of some of these achievements of our great staff, including honours received from Her Royal Highness Queen Elizabeth II, with both Professor Simon Harding, consultant ophthalmologist, being awarded the Member of the Order of the British Empire, MBE, and Professor Cheng Hock To, a consultant haematologist here at Luft, being appointed an Honorary Commander of the Most Excellent Order of the British Empire, or CBE. Other highlights included Liverpool University Dental Hospital's nursing team being awarded the Outstanding Team during COVID-19 by the Society of British Dental Nurses. 4 teams here at Luft were shortlisted for 7 awards between them at the Nursing Times Awards in 2021. 2 of our biomedical scientists working in Liverpool Clinical Laboratories, that was Hannah Williams and Emma Larne, recognised with the Rising Star Award in the 2021 Chief Scientific Officers Excellence in Healthcare Science Awards. And Professor John Brennan, Consultant Vascular Surgeon, was honoured with a Lifetime Achievement Award by the Vascular Society, recognising his contribution to vascular surgery over the last 25 years and his role in the forefront of vascular education. So many congratulations to all of those individuals and to all of our amazing colleagues who were recognised with honours and awards throughout the year. During the year, we also continued Liverpool's proud history of delivering some world firsts in both healthcare and clinical research, honouring our commitment to great research and innovation. And again, just to select a few highlights from our extensive research activity throughout the year, Luft was involved in a new clinical trial to promote a third booster COVID-19 vaccine, with the trial being launched here at the Royal Liverpool Hospital. The Cove Boost study was backed by a £19.3 million grant of government funding through the Vaccines Task Force, and was the first in the world to provide vital data on the impact of a third dose on patients' immune responses. Second highlight is the award of £5.3 million to the Liverpool Clinical Research Facility, coming from the National Institute for Health Research. And this is focused on investigating new treatments for some of the most common diseases and health problems that affect people in our region. This major investment recognized the significant impact that the Clinical Research Facility has had over the last 5 years and was a real vote of confidence. And the funding allows our clinical research facility to work in partnership and collaboration with colleagues from Clatterbridge and Liverpool Heart and Chest to tackle local health issues that are present. We've got some of the highest rates, unfortunately, of cancer and heart disease in the country. The funding will support research into conditions such as Alzheimer's, dementia, Parkinson's, Huntington's disease, and some inflammatory conditions including asthma, arthritis, eczema, and psoriasis, as well as the treatment of infectious diseases, including HIV and TB, and supporting new vaccines. And the final highlight I wanted to mention was a new drug, faricimab, I hope I pronounced that properly, which has been trialled at the Trust's Clinical Eye Research Centre and is now helping to save the eyesight of millions of people with diabetic eye disease. So we've been selected to work with biotech company Roche as part of an international study into the treatment of diabetic macular edema, which is the most common cause of sight loss in people with diabetes. The centre here recruited the most patients of any research site in the UK, and the research helped to get the drug approved by NICE for all of these patients, reducing their need for injections, going from needing an injection every 4 to 8 weeks, potentially just 3 times a year. Our surgical innovations under our Great Care category are helping to transform people's lives and improve the quality of care we can provide to our patients. In February 22, a grandmother of 3 became the first woman in Merseyside to receive hip replacement surgery and to go home on the same day. So Bernice Gay, who's pictured here, had her hip replacement and was discharged just 8 hours after her surgery, which took place on the Broad Green site. This new day case procedure will really help to reduce waiting lists for orthopedic treatments and enable patients to recover in the comfort of their own home, avoiding lengthy hospital stays. And under our 4th Great Ambitions, we've embarked on a substantial program of investment across all of our sites. This year saw significant activity around the completion of the building work on the new Royal site, as well as investment in upgrading and improving every site. James will highlight in more detail the developments currently underway at Aintree in a moment, and I'm delighted to say that the significant first phase of that £15 million renovation to rejuvenate the Aintree University Hospital was completed in July 21, creating a new main entrance and upgrading the tower block, giving the hospital a more modern feel and providing simpler, safer and more welcoming drop-off facilities for patients. All of this is part of our commitment to improving patient experience and investing in the quality of healthcare facilities available in all of our hospital sites. I did want to mention that patients in the region also benefited from faster diagnosis of head and neck cancers, thanks to some new state-of-the-art ultrasound equipment for the Liverpool Head and Neck Centre, which is also based at the Aintree site. The Head and Neck Centre is delivered through a strong partnership between the Trust, Clatterbridge, the Walton Centre and the University of Liverpool. And the equipment that's really delivered fantastic results was funded through a very generous charitable donation of £75,000 from the Marina Dalgleish appeal. During this year of transition, we welcomed 2 new non-executive directors and made some key substantive appointments to our executive team. These changes have immeasurably strengthened the leadership capacity of the Trust. So our 2 new non-exec appointments saw Professor Tom Whalley and Ibrahim Ibi Ismail join the board. Tom joined us in July 21. He's the Associate Pro Vice Chancellor for Clinical Research at the University of Liverpool and held a long consultant physician career here at the Royal. So Tom brings a wealth of clinical, academic and research expertise to the board. And Ibi joined the board in September 21 and brings over 19 years experience of working locally, regionally and nationally in the voluntary and community sector. Ibi's passion is in helping systems and institutions to be inclusive and rooted in their local community to enable them to tackle health and social inequalities. So both Tom and Ibi bring valuable skills to our leadership team. During the year, we also made 3 key appointments to the executive part of our board. So James, our Chief Executive, was appointed in February 22 and started his role at the Trust in May. James brings more than 20 years of experience in the NHS and was previously Chief Executive at Mid Cheshire Hospitals. We've also welcomed Jim Gardner, who was appointed in February 22 and started his new role at the Trust in June. And Jim joined us from Blackpool Teaching Hospitals, where he had been the medical director. And in a career spanning over 30 years, Jim has undertaken senior leadership roles across primary and secondary care, the private sector, charitable sector, and academia. And also delighted that David Melia was appointed in March 22 and joined us as Chief Nurse in July. David is the former Director of Nursing and Quality at Mid Yorkshire Hospitals. He's originally from Liverpool and is both a registered general nurse and registered nurse for people with learning disabilities. And he's previously held Director of Nursing roles at the Walton Centre and Warrington and Halton Teaching Hospitals. So all 3 exec colleagues have been fantastic additions to the Trust, bringing superb leadership skill and experience. So in summary, 2021-22 was a year of transition with a significant amount of challenge and change for us, but despite all of this, we remain focused on delivering against our core strategic priorities of great care, great people, great research and innovation, and great ambitions. I want to thank all of our colleagues for their dedicated hard work, commitment to caring for patients during a year of really unprecedented challenge. So that's the year in review. I'm now going to hand over to James, our Chief Executive, and ask him to present more of a forward look, bringing us up to date and setting out our priorities for the future. Thank you.
Thanks, Sue. I'm going to talk a little bit about our future together and what that means to us. And just wanted to say, as Sue's just mentioned, I'm relatively new appointment to the Trust, been here about 6 months now, and it's a real honour and a privilege to be appointed here at Lufft as Chief Executive. A lot of what Sue's been talking about has covered the last financial year, and in this last section now, I just wanted to spend a little time looking at where we are today and some of the things we've achieved. So next slide, please. So on the next slide, when it arrives, I will show you or tell you a little bit about our strategic framework. And within our organisation, we have 4 areas that we particularly focus on in terms of our future strategy. And there's some exceptional work taking place across the hospitals, and I can say since my arrival here that I've been really blown away with some of those really fantastic services, really fantastic people. So it's been really interesting to get around the organisation, talk to staff, talk to patients, and see what's going on. And this strategic framework of the 4 greats has really given us a framework to build on for the future. And in this year, we've really delivered some fantastic things for healthcare in Liverpool. So as you can see on the slide, we've got 4 areas that we particularly focused on. One is great care and being safe, caring and effective. And as Sue said, there's been challenges around some of that over the last couple of years, but we've got a really good improvement plan in place to deliver better care for our patients. And I can see already improvements in many areas. Research and innovation, again, Sue's touched on this, and we're really interested in how we can take that further. high quality research and organisations that participate in research have better health outcomes. That's a fact. It is something that is demonstrable the world over. And really important to our staff. You know, and I know that NHS staff are under the most strain that they've been probably in the history of the NHS. COVID has been a real challenge. The recovery post-COVID is an even bigger challenge. And whilst we've got fantastic people, we need to support them better and we need to improve their experience of working in the NHS and here at Love. So we're doing a lot of work around that. And also we've got a lot of things that we want to do around different ambitions around partnerships, working with other organisations, in particular social care, local GPs and digital programmes as well, to try and bring us up to the 21st century in the NHS, which is still some work to do, but we can see a way forward with that. Next slide, please. So what you can see on the slide there is some pictures of the new Royals, some of the patients, some of our fantastic staff, some of the new equipment, some of the new facilities. And as Sue's already touched on, I'm really delighted to say that we've now completed that move. It's been a really long journey to get here. Many people over many years have had serious challenges getting us to where we are today, but our staff couldn't wait to get into that new facility. And it was a 24-day move plan. It moved 600 patients into all sorts of high-risk areas, and we didn't have a single clinical incident. So really well done to all of our teams for actually delivering that. The new Royal, as you probably know now, delivers a really state-of-the-art modern hospital for the people of Liverpool, which has been long awaited and really is greatly deserved. Some of the key features of the Royal, 100% single ensuite rooms, real benefits to that, and not just from an infection control perspective, but as I walk around and talk to staff and patients are getting a better night's sleep, which is really important for recovery. There's less disturbance, and also they've got better privacy and dignity in that ward environment. And our clinicians can talk to patients in a nice, secure environment with all the equipment that you might need in one of those single rooms, which is brilliant. We've had lots of benefits of things like the co-location of services. So critical care in the old Royal was across 3 different floors and patients had to be ferried up and down in lifts. And now we've got a full floor of critical care. 3 departments that have been separated by concrete for years are now all in the same space and working really well together for the benefit of our patients. We've got fantastic new facilities for treatment and lots of stuff that when you see it, I think you'll notice is significantly better than probably anything you've seen before. If you're interested in what it takes to move a hospital, there's a 30-minute special feature which is on the BBC iPlayer now, which will show you the move in detail. So that talks you through what it takes to move an organisation this size. I wish it had been there and ahead of the move and I could have watched it in advance, but it's great now to look back on what we actually achieved and what we did, and there's some fantastic stuff there for people to see. It makes you very proud to be part of the city. Next slide, please. So as well as that new Royal, we've also got fantastic developments on our other sites as well. Here's a picture on the screen of Aintree, which is almost unrecognisable in some parts in terms of the not just the facelift programme, but also in upgrades to the tower block, the main entrance. But really importantly, behind all of that, there are changes to things like new assessment areas, new CT scanners for assessing potential stroke patients, increased capacity for ambulance drop-off bays, new hybrid operating theatres, which are going to be fantastic for our vascular and specialist services. So we're doing a complete refurbishment of that area. Now, those changes have allowed us to do a number of things, and we've already opened a new hyperacute stroke service in Aintree during September, following a successful public consultation. And that brings together services that were at the Royal, at Aintree and at Southport into one comprehensive unit to serve everybody in North Merseyside. Now, this is really important because for stroke care, it's really imperative that you get to the right specialist people with the right tests, the right equipment, the right procedures in place to diagnose and treat that stroke as quickly as possible. There is a critical period of time, 72 hours maximum after a stroke occurs, that you need that treatment. By locating everything at Aintree, not only have we got all those things now in the same place, but we're also connected to the Walton Centre, which is our specialist neurosciences hospital in Liverpool. And that provides a stroke treatment called thrombectomy. And thrombectomy is where we insert a wire into an artery, feed that wire into the brain, and literally pluck the clot out of the brain. And that has a significant improvement on recovery and long-term prognosis and short-term benefit for people who have a stroke. And that is now available 24 hours a day, 7 days a week to anyone in the city and in North Mersey who might need it. So that is a good evidence-based co-location of services that will have a huge impact for outcomes of patients. And I've been and spoken to staff and patients over there, and we're seeing now people who previously might not have got that care getting it first time, which is fantastic. Alongside the work that's gone on over at Aintree, so next slide please, we've got a number of other services that are moving around the city, and this has all been consulted on. There's been a comprehensive public consultation. 2,800 people contributed their views in writing, with the vast majority supporting these plans as a good way for how we organise services better across Aintree, the Royal Liverpool and Broad Green. The move to the new hospital has been huge, but alongside these service changes, all of which have moved either across to Aintree or across to the Royal at the same time, is a scale of change I've not seen or experienced in the NHS in my career. So again, it's a real testament to the exceptional work of the staff here that we've managed to deliver that scale of change. Now, briefly, those 5 service moves, and you can see on the screen the list there, are that breast surgery is now co-located at the Royal Liverpool University Hospital. And what that means is all the skills of all of our fantastic surgeons can do really complex breast surgery, cancer surgery, all here connected to the cancer hospital with all of the right facilities that you might need, and a really robust, concentrated number of specialist skills. That doesn't affect our outpatient clinics, and people can still have an outpatient clinic and their scans and other things done at Aintree and the Royal. So we're not asking loads of people to move, but when you really need that really complex surgery, that's when you will come to the new specialist centre. For general surgery, all planned general surgery that's complicated will now take place at the Royal Liverpool. And as you can see here, this is about the Royal Liverpool becoming the complex planned surgical centre, and Aintree being where the emergency, very complex and difficult emergency care happens. So for planned general surgery, that will be at the Royal. And over time, it's our ambition to move the emergency general surgery to Aintree, because we have emergency facilities there like trauma, major trauma, stroke, vascular emergency, and all the right things in the right place to have a fantastic emergency hospital. That's not happened just yet because we want to make sure we've got all the facilities in place, but that's still planned. Nephrology, which is basically kidney care, is now centralised in a single specialist kidney centre at the Royal. And we still have some of this care taking place at Aintree at the moment, and there are satellite centres in Aintree, Broad Green, St Helens, Warrington, Halton, Waterloo, Southport, and all over the place that will feed into that centre. But again, by co-locating all those specialist skills, we know that when you come in for the really high-end treatment, if it's required, you're going to get that from the best team of people, all with the best equipment and the right skills in the right place. The same is the case of urology. That again, specialist complex planned surgery will come over to, or has come over to the Royal, but we'll still see people at Aintree and we'll still see people at the Royal for outpatients and tests. So there's not a huge change of traffic. It's more around when you need that life-changing operation. And the same with vascular. And now vascular, all that care is going to move, and has moved actually, to Aintree Hospital. Some of that was at the Royal previously. Again, the outpatient clinics aren't changing. They're still at Wiston, at Southport, at Liverpool Heart and Chest, at Aintree and the Royal. So it's only that inpatient care. But as I said earlier, the development of fantastic new hybrid theatre facilities over at Aintree and that new emergency floor is going to make this a really fantastic facility for emergency vascular care, which is great. So for anybody who uses these services, what I do want you to hear, if there is one message to take away, is you don't need to do anything. You don't need to go and remember to go to different hospitals. You would hear from us if you need to go somewhere different. And because a lot of the outpatient facilities are staying in the same places, you'll still go and see people in the normal order of things. It might just be that you would go to a different hospital for that major surgery if you require. So for me, this is a really great insight into what can be achieved here at Luft, because all the same people who perhaps have had some of the challenges that Sue outlined have also delivered these amazing changes at the same time of running a hospital day to day and delivering good care for the people of our city. So really important that we reflect on what we've done well, really important that we reflect on the areas that we need to improve. But this gives me real confidence that this organisation can go from strength to strength as we tackle some of those bigger challenges over the next few years. So thank you. I'm going to hand back now to Sue for the question and answer session.
Thanks very much, James. Thanks very much, James. That was great, and we have a lot to look forward to for next year's annual members meeting, updating us on the progress of all of that activity. So actually, I'm going to ask Daniel Sheffer, our company secretary, to read out the questions and direct the member of the board who will be providing the answer. Daniel, over to you, please.
Thank you, Sue. Thank you, Sue, and thank you to those who have done the presentations and also to our governors. Now we've got about half an hour left, and so what I'm going to try and do is go through the questions that we've received in advance, and I'll also look to cover some of the questions that are being asked as the presentations are going on. So in advance, we asked members of the trust, governors and members of the public to give us some questions that they were interested in. So I'm just going to start off with a question. Obviously, there's been quite a lot in the local news recently about reports of long waits in our A&E departments across our 2 sites. And we've had a question which is about what is being done to increase efficiency when diagnosing and treating and reducing length of stay for patients. So I'm just going to ask David, can you just give us how are things at the moment and what is the work that's taking place within the trust?
Thank you, Daniel. Thank you, colleagues. And whoever submitted the question, thank you for bringing it forward. As Daniel said, it's commonly known throughout the country, isn't it, that there are huge pressures within emergency services throughout the length and breadth of the country. And at Luft, we have exactly the same problems, and that's been well documented in both the local and some of the national press. It's a whole number of different reasons for why that's the case. I think one of the issues that we see within the organisation is that we have a difficulty with that flow of patients moving from ambulance into the A&E department, and then those patients that need to be admitted to a bed, that takes a long time, because we have lots of patients in our hospitals who really should be being cared for in other places, in care homes, residential homes, or within their own homes with domiciliary care. And that's the part where we have a problem with our patient flow. And indeed, nearly a quarter of our beds across the whole of the trust have patients in that really should be cared for in other places. And that isn't unusual. That isn't just a Luft problem. That same issue is happening everywhere, and again, very well reported in the press. And so, whilst we are looking at the ways in which we work, can we be smarter, quicker, more efficient in our own processes, both in caring for patients and making sure that we're not putting a delay in care, we are working with our system partners, local authorities, other organisations, to see how can we help free up some of those beds within the community and move those patients out. I know that this isn't a good experience. It's certainly not a good experience with our patients, whether they're the patients who are waiting for an ambulance to come to them and there's a delay, or a delay within the hospital. And we all recognise that, and that's why we're really keen and working hard on this. And I, on behalf of everybody, we would wish to say a big sorry, and we will look at every circumstance individually where we can to make things better. I know the person who wrote the question also made comments about sometimes there isn't a sense of urgency from some of our clinical staff when they're in the hospital, and I'm really sorry if that's been someone's experience. I have to say it's not what I see, and it's not what I've witnessed when I've been going around the clinical areas. But if somebody does have a concern that they wish to raise, if they let us know about it, we will certainly investigate. Thank you.
Okay, thanks, David, for that. I'm going to link into one of the questions that's come through as we've been doing the presentation. So obviously those concerns that people have about waiting times in A&E, obviously that may be heightened a little bit by the announcement yesterday about impending industrial action. So we've had a question about how can we best support our staff in achieving their objectives during the industrial action. I'm just going to ask Elaine Butchard to provide a bit of an update on what's going on. What information do we have as an organisation at the moment on that?
Okay, so we know at the moment, obviously, we're one of the organisations where the RCN have, as part of the ballot, voted to take strike action. At the moment, we don't know the date of that. We have to be given 2 weeks' notice of any impending strike action. I think it's important in terms of that question is that we do value our staff and we understand the importance of good pay and conditions. And this is a national issue that is taking place currently. However, we have a really good working relationship with our local trade unions. So we are working very closely with our trade union colleagues around that issue, just to ensure that our staff feel supported, because we understand that they have a right to be a member of a trade union to take lawful industrial action. So our communications reflect that really. So that's really some of the things that we're doing to support our staff through this process. It is a challenge because it's a national issue, but we're managing this locally. But we are working, as I say, very closely with our trade union colleagues, and we're continuing to receive further guidance on this issue, Daniel. Thank you.
Okay, thanks very much, Elaine. So obviously one of the key issues is we know obviously the announcement was only made yesterday, and obviously we'll be supporting staff and obviously making sure information's available to the public once we know how things are moving forward. So thanks for that, Elaine. Okay, we've had another question from one of our members where they've used some experience about their experience of the services they received when they were referred to the trust by their general practitioner. And they've asked, are we doing some more specific training to reception staff to help them when we're dealing with these? And I'm just going to ask James if he can just give us an answer on this one.
Thanks, Daniel. Well, firstly, and I've got a copy of the whole question here, so this is specifically about reception staff and a couple of occasions of people or an individual not getting the service that they should expect. So firstly, sorry that you've experienced that, and that didn't happen on this occasion. You know, we do strive to improve that constantly. We are working on interactions with GPs, and there is lots to do there. But your specific point about you've experienced good reception service and you've experienced bad reception service, so I'll take that on board, and I think we can certainly look at what training our reception staff get through the trust and where we've got pockets of good work and where we might have more to do. So we'll take that on board, and thank you for raising it.
Okay, thank you, James. So just coming back, we've had another question, obviously following the recent media coverage about ambulance delays outside of A&E departments. And David, I just want, can you give us a bit of an update on what support are we giving, obviously, our colleagues from North West Ambulance Service, and how are we actually supporting patients as they're being potentially delayed as they're coming through our A&E department?
Thank you. So it's been really important for us to have real good communication and contact with our ambulance colleagues, because they have a big strain and a pressure put upon them. And so we work with them around how they can safely bring their patients into the hospital, and how we collectively look after those patients who are waiting to be seen. So that's one thing that we've done. We are working with them to ensure that we are not delaying the transfer of those patients as much as we possibly can, not just with the crews directly, but with the senior leadership in the ambulance service as well. I think it's important that to note that we know that our own staff are feeling the strain of this pressure as well. So we are ensuring that we have senior leadership teams going round 24 hours a day and 7 days a week to make sure that staff are getting support. But we recognise this is an incredibly pressured system. And indeed, only yesterday, some of us met with some of the senior leadership of the A&E departments at the Royal, just to see how we can further work together to make it a better environment in which to provide care.
Okay, thanks, David. Obviously, this is going to be an ongoing issue, not just in Luft, but we know across the NHS, and obviously we'll be looking to continue that work and supporting colleagues as we go forward over coming months. Okay, so we've also had a question from one of our trust members where they've raised an issue about why are we doing this year's annual members meeting virtually. So what they've asked for is they could understand why we had to do these types of meetings virtually during COVID, but obviously what they're concerned about is how do we move back so we can have these debates in person and we can have them in a live setting. So I'm just going to pose that as obviously as chair of the trust and obviously chair of the Council of Governors. Sue, can you just give us an update on what do you think about virtual meetings and moving back to face-to-face?
Yeah, thanks very much, Daniel. Well, it's certainly been an education, hasn't it? We've seen the benefits, I think, of meeting virtually when it is a more perhaps transactional process. That's been a real advantage. So there are positives of both forms of meeting. I think you can't beat a face-to-face meeting when you're really trying to get to know people and having a more free-ranging conversation. So I think as we go forward, what we've wanted to do is take the benefits of our virtual platforms and build that into our business as usual where that's appropriate, and also make sure that we're meeting face-to-face, recognizing that that really does help getting to know colleagues and enabling a more wider discussion to happen. I think there were very specific circumstances that we need to be aware of in terms of the preparation for this particular meeting. I know virtual doesn't work for everybody, but please remember that we've only been in the new Royal and gone through all of those changes that James was talking about for the last couple of weeks. It only finished really at the end of October. So as we were planning the preparation for the annual members meeting, it was at a time of facing a significant amount of change, and we had to be really mindful, I think, of the burden that the preparation puts on our colleagues, and to make sure that we weren't putting them under undue stress. So we thought it was the best option for this meeting to be held virtually. But certainly, you know, I would want to stress that we have returned to face-to-face meetings for our board meetings, for our Council of Governor meetings. We keep in touch with infection prevention control guidance, and we've had over the last nearly 3 years, you know, many episodes where guidance has changed, where we've been able to reintroduce visiting or face-to-face meetings and then gone back to restrictions. So we just need to keep that in mind. And certainly, you know, my expectation is that life will look a bit different when we're planning for our annual members meeting next year. And I very much hope that that option of holding that in person will be the way forward. Thank you very much.
Okay, thanks, Sue. So just a reminder for those who are on the this annual members meeting, don't forget to look at our trust website, which gives details of our future meetings for our public board of directors, but also Council of Governors. And I think the challenge, Sue, is very much working with the Council of Governors in how do we as an organisation plan next year's annual meeting to actually meet the needs of all of our members and all of our Council of Governors. So thanks for that. I'm going to move on to the next question. Now, on this particular question, we've been specifically asked so that I read the whole of the question. So the questions that you've had before, I've given a little bit of a summary of them. And as we've said before, as Sue said earlier, we'll be publishing full details of the questions together with the answers that we've given. But on this one, we've specifically been asked to read out the whole of the question. So please bear with me, and I'll apologise in advance if I get any of these medical pronunciations wrong. I should have spoken to our medical director first just to make sure I got them right. So this is a question where they've asked, I have a relative who's been told before the pandemic in Liverpool, looked after by the Royal, now Luft, that they are likely to need further bowel surgery. It has also been called intestinal failure surgery. Pre-pandemic, it was clear that this would occur in Liverpool. However, my understanding now is that the Luft executive team, not frontline doctors and nurses, gave up and did not appeal this decision when clinicians wanted them to do so. Intestinal failure surgery is moving to the Royal Salford Royal, despite actually the trust scoring very well in a national tender to appoint surgical centres. It has been reported as Liverpool scoring as high as 4th to 5th in England. My understanding is this led to an exodus of staff from the Royal site, with a number of intestinal failure consultants being very unhappy that the trust did not appeal this decision, now leaving the nutrition team threadbare. For my relative, it would be very expensive to travel to and from Liverpool to Manchester, and also time consuming. Plus, if they were hospitalised in Liverpool, they would have to wait a significant period of time to be transferred to Salford, if they even agreed to be transferred, blocking much needed beds in Liverpool. It feels like Luft have done their disservice to patients and the staff who shared their concerns. Given Luft now can't deliver this intestinal failure service, and also given that other specialties like colorectal surgery, hepatobiliary surgery, liver surgery, cancer surgery, and vascular surgery can have patients who need intestinal failure surgery. This seems like a catastrophic mistake by the Luft executive to give up this service, which presumably will be very difficult to ever get back. Was this an objective of the merger to give up essential services to Manchester and level down in an area of health inequalities already? Is there a recognition from the executive this was a huge mistake, and if not, why not? And what do I say to my poor relative now? Either go to Salford or don't have your surgery. So I'm just going to hand this over to our Chief Medical Officer, Jim Gardner. So Jim.
Thanks, Daniel. I thought you did very well with the pronunciation, so thank you for that. So, firstly, it is correct that Luft was unsuccessful in its bid to become a centre providing severe intestinal failure service. Let's just be clear, there is quite a distinction between all intestinal failure surgery and severe intestinal failure surgery, and we do perform quite a lot of intestinal failure surgery. So in answer to the query about the question as relative, it's not at all clear from the information I've got that relative would not get the surgery at Liverpool. It's quite possible. The commissioning process was of course run by NHS England specialised commissioners. The tender was awarded to Salford. There was querying of the outcome of the tender because, as you said, Daniel, the trust did score very highly in that. Indeed, it was clear that the trust had scored more highly than other bidders around the country who were awarded the service. So one can see how it was very painful for colleagues in the Royal, and there was indeed a loss of some senior and valued clinical staff as a consequence. Our current position is that we work very closely with Salford to ensure that the very small number of patients requiring severe intestinal failure surgery are managed between our two multidisciplinary teams and are transferred in a timely manner when that surgery is required. And actually this is the same as many other highly specialised services that move across the Northwest, some patients coming to us, of course, let's say for renal transplantation in a similar way. So we continue to provide a very high level of intestinal failure service, including home parenteral nutrition for much of Cheshire and Merseyside. We've still got considerable expertise in that whole area, and of course the moves that James described in detail of bringing complex gastrointestinal services and liver surgery into the Royal has generated new centres of expertise which we'll continue to build on. So in summary, we are still providing the bulk of an intestinal failure service. There are some very, very specific complex cases where patients are transferred to Salford for very, very specialised treatment.
Thank you very much, Jim, for that comprehensive answer. So thank you. So we've had another, moving back to some of the issues around staffing, we've had a question which is a bit of a follow-up question to last year's annual members meeting. So last year's annual members meeting, there was questions about the issues in relation to recruitment of staff into Luft, but also the retention issues. And obviously we've had a question about, have governors looked into the findings of exit interviews? Now, obviously, what we do in the annual members meeting, we pose the questions to members of the board, and we'll pick up the issues with the Council of Governors going forward. So in relation to that recruitment and retention, but also the important issues about understanding what comes out of exit interviews, I'm just going to ask Elaine just to provide an update.
Okay, so I'll take the issue around recruitment. So as part of our Safer Staffing Review that was carried out by the Trust in early 2022, nursing establishment budgets were increased across the Trust on all sites. And as well as that, linked to the new hospital, we significantly recruited to hundreds of roles across the organisation, which allowed us to open the new hospital and conduct some of those service changes following public consultation. So our recruitment process has been really successful, and a number of individuals and a significant number have been new to care, including some apprentices as well from the city region. As part of our plan to become a great place to work and learn, we are looking at reviewing and changing our organisational culture, which is all part of the retention work that we need to do. And as part of this work, we are implementing the NHS culture leadership and culture programme, and that will be over for the next 3 to 5 years. So it is a long-term project. Our chief executive leads the culture steering group that focuses on implementing and the coordinating the work, and this also includes, because the question included was around health and wellbeing as well, so it also looks at those issues around health and wellbeing and other impacts. And part of that, our metrics include things like exit interviews, etc., to understand why people are leaving the organisation, so we can take action and understand where our areas of concern are within the organisation. So we've agreed those metrics, and that will help us to understand and measure the progress and identify if there are any issues or concerns that need to be escalated to Trust Board. Thank you.
Thanks very much, Elaine, for that. And what I'd encourage people, this is a regular issue that's discussed at our public board meetings, and members of the public and our governors will be able to see the questions that are asked at our board and progress that we're making in terms of those really important issues. I've just been told we've got about 6 minutes left, so the live Q&A is now being closed. So I'm going to use the next 6 minutes to get through as many questions as possible. So I'm just going to pose a question in relation to, we've had a question about about the use of single rooms. Now, we're really proud of the fact that the new Royal has single rooms, but obviously we've been asked a question about what assurance can we give that single rooms will be safe in the new Royal. So David, can you help us out on this one?
Yeah, thank you very much. So I'll keep it to the point. So every patient that's ever admitted into hospital always has a full assessment anyway, so we know what level of care that they will require, and so we know if there are at any particular risks or risk of any harms or any deterioration, and so that's the basis really of how we care for them. So the actual idea of them being in a side room is different. It's a different for our organisation as it is for everybody, that all our rooms are single. As James mentioned earlier on, we've had some very positive effects, that patients are finding that they're able to rest well, sleep well overnight, and that causes them to be healthier or stronger or less distressed during the night and then in the daytime as well. Our nursing staff are working in different ways. We have different ways that they're allocated around the ward. So they work in what we're calling pods of 8 rooms. So there's a registered nurse and a healthcare assistant. On top of that, there is a supervisory registered nurse as a coordinator, who isn't included in in the hands-on numbers, and then the ward manager themselves, 80% of their time is supervisory, not included in numbers, so that they're circulating round. And of course, nurses aren't the only people who are working on the ward, therapists, medical staff, and we are recruiting volunteers as well. I think in the short time that we've been in the new hospital, we've been really conscious of looking out for any early warnings of any failings or any harms to patients, and I'm pleased to say that we haven't seen anything that's causing us to have any concern about the new model of care.
Thanks, David. I mean, it's really exciting times for people who are using those services. So thank you. I mean, what's going to be important for us as an organisation is how we keep monitoring those the effect that it's having on patients and the improvements that it has on patient care. So obviously keep up, and we'll use the board meetings and council of governors to keep people up to date. So the last question today is actually one that's a real burning issue, I think, for many members of our staff. So it's an issue that obviously people read about in the media, which is about the cost of living crisis, and obviously staff working just as members of the public are feeling the effects of that. And what the question is what initiatives are we doing as an organisation to help our staff during these cost of living crises? So Elaine, can you help us out here on the initiatives that have been taken?
Yes, certainly. So, I mean, obviously we are, as you said, Daniel, we're aware of these issues, and it is a topic that we discuss routinely with our trade union colleagues and also other staff members as well, really, because we do want to support staff as much as we can. So one of the things that we have done is in September we launched something called Life at Luft, and this is a one-stop website, and it has information and support on physical, mental, financial and employment issues, and has been developed by occupational health and our organisational development teams as well. As part of our financial support, we've implemented something called Wage Stream, and this is so staff can access their pay outside of regular pay dates, and this avoids them having to use things like high interest loans. It also allows staff to save money as well and to budget responsibly. In addition, if staff were a member of the NHS Credit Union, and we've publicised that as well to ensure that staff have access to those things and receive financial advice and access credible loans. We've also promoted locally, we have discounted travel on Arriva, transport for staff, that's unlimited and also includes family members as well. For staff who are in any financial distress at all, we have a referral service which is confidential through occupational health to food banks, which are accessed locally as well. We are arranging some sessions with our colleagues from sustainability around energy advice, because we know that again is a big issue for us all, and whatever we can do to help staff and to promote some of the things that they can do to help them really. There's lots of national offers that we are seeking support on, so to ensure that our staff have access to those things. So any of those things that in terms of local or national initiatives, we're ensuring that staff have access to those things really. We're also looking at what we can do in terms of sustainable options for staff in terms of hot food and food options for them as well. So we're exploring those issues to see what else we can do to make sure that staff have hot food available to them, and microwaves, etc., are available in staff areas and in the staff restaurants, so people can have access to those things as well. So there's a number of things that we're doing, but that is a constantly developing area, Daniel, because it's one of the areas that we know is, as you said, a big issue for our staff.
Thanks very much, Elaine, for that. And obviously, as you just said, it's going to be a continual issue that we need to discuss and listen to our staff on. So I'm just going to hand back to Sue as the chair, just to do the closing remarks. But can I just thank our governors, the members of the public, but also my colleagues for their frank and honest answers. So thank you, and back to you, Sue.
Thanks so much. Okay, great. Well, it's 7 o'clock, so I'm not going to keep you. I will just echo Daniel's thanks. We've had a really busy year. We've got a really busy present, and a really busy future. So we appreciate you taking the time to join us to hear more about last year's highlights. Thanks so much for sticking with us. We appreciate you as members and governors, members of the public who are supporting the Trust. Thank you so much for joining us. Have a good evening. Thank you. Good night.